Yeah.
Hello, Professor Gale and fellow classmates. We are Group 9, Arianne, Jaspal, Lorena, Krystal, and Wenlei. Today we will be discussing the nursing theorist Ida Jean Orlando and her development of deliberative nursing process theory.
Major concepts. Orlando's theory contains 5 major concepts. These are: first, professional nursing function, organizing principle. Second, the patient's presenting behavior, problematic situation. Third, immediate reaction, internal response. Fourth, nursing process discipline, investigation. And fifth, improvement resolution.
Professional nursing functions organizing principle. According to Orlando, the theory that is distinct in nursing practice can be reflected in the function of nurses as finding out and meeting the patient's immediate needs for help. Since the patient is the center of care, nurses are to focus their attention to help and meet the immediate needs of the patient for the purpose of avoiding, relieving, diminishing, or curing the individual's sense of helplessness. The nurse's responsibility is providing care directly or asking for the services of others to assist care of the patient.
In the exploratory stage of assessment, the nurse and patient are in active participation to examine the immediate needs of the patient. The behavior presented by the patient is the stimulus for the nurse to assess and provide care accordingly. These behaviors can be assessed through verbal communication like complaints and requests from the patient, while nonverbal can be assessed through facial grimace or guarding of affected body part. However, not all behavior represents true needs. It is the nurse's task to validate and understand these behavior and acts in the context of the patient's expectation and understanding.
The immediate response of the nurse is comprised of her knowledge and skill, which makes the response unique to every situation. According to Orlando, the reaction occurs in almost instantaneous sequence. The first one being the person perceives with any one of his 5 senses. Second, the perception stimulates automatic thought. Third, each thought stimulates an automatic feeling. And lastly, the person reacts. This sequence can be likened to nursing process. The immediate reaction from the nurse is the result of the assessment that has transpired between nurse-patient relationship.
The action of the nurse and patient has a dynamic effect on each other. In each nurse-patient encounter, a deliberative process of inquiry is required of the nurse to prevent automatic responses that can be faulty. For nurses, it is not enough to use past experiences and assume that each patient has similar needs. Nurses solely acting on assumptions will contribute to the situational crisis. According to Orlando, the nurse does not assume that any aspect of her reaction to the patient is correct, helpful, or appropriate until she checks the validity of it in exploration with the patient. The nurse will find it more efficient to learn the nature of the patient's immediate need by first exploring and understanding the meaning of the patient's perception. The patient is more likely to agree with the correctness of the perception and often explains its meaning to the nurse. Efficiency is important because the longer it takes to determine the patient's immediate need, the more distressed the patient becomes. According to Orlando, when nurses express their immediate actions to patients in a deliberative way, they are more likely to meet patients' need. Because when nurses use deliberative nursing process, patients are more likely to use it as well. Therefore, both nurses and patients have a better understanding of the immediate situation. If this is not done, patients remain distressed because the communication between them was unclear, and the nurse's response to the patient did not meet the patient's needs.
The improvement on the patient can be determined by verbal and nonverbal behavior. If the patient determines that the problematic situation has not been resolved, the function of the nurse has not been met. Thus, the need for continuity of care until improvement occurs. The deliberative nursing process is a dynamic activity as opposed to a linear process. The nurse continuously self-reflects on the actions performed and ponders if these attempt actions have answered the behavior projected by the patient. If not met, the nurse must go back and forth through the process until the patient is satisfied and determine that the problematic situation has been resolved.
The nursing process theory has 5 sequential steps. assessment, diagnosis, planning, implementation, and evaluation. In assessment, it involves data collection while using critical thinking. Data may come from the patient, friends, or from the primary caregivers who may not be direct relation family members. Electronic health records may be populate data in and assist in assessment. Tony Butler and Tyer. In diagnosis, nurses use the theory and knowledge to critically judge the health problem presented by the patient. By the end of this phase, a nursing diagnosis is formulated.
In planning, patient-specific goals and outcomes are formulated to ensure positive outcome. Care plans provide a course of direction for personalized care tailored to an individual's unique needs. Goals should be specific, measurable, attainable, realistic, and timely. In implementation, actions are done to carry out nursing interventions outlined in the care plan. Tony Butler and Thayer. Lastly, the evaluation. This phase is important to a positive patient outcome. Whenever a patient provider implements care, they must reassess to ensure the desired outcome has been met. Reassessment may frequently be needed depending upon overall patient condition.
Identifying the assumptions of theory are fundamental to develop an understanding of the theory. Orlando's theory reflects her belief that the nursing practice should be based on the needs of the patient. Hence, communication with the patient was fundamental to understanding the needs and providing effective nursing care. The essence of her theory is its focus on the patient and his or her needs and the communicative interface between the nurse and the patient. The following assumptions are identified in her writings. The nurse process include identify the needs of the patients, the response of the nurse, the nursing actions. The nursing process described by Orlando is not the linear nursing process model taught today in the nursing education, but is more reflexive and circular, occurring during encounter with the patients. Understanding the meaning of the patient's behavior is influenced by the nurse's perception, thoughts, feelings, requiring deliberative response. Orlando argues that this deliberative process can be taught in educational programs, and nursing students can learn to use it in patient care situations.
Patients experience distress when they cannot cope with their needs. The nurse must take the initiative in helping the patient express the meaning of behavior to ascertain distress. The basis for nursing action is determined by distress experienced by the patient. Direct and indirect observations of patient behavior can be used to determine its meaning and thus provide knowledge about the patient in planning nursing care. Interactions with patients are unique, complex, and dynamic. According to Parker, professional nurses function in an independent role, separating from physicians and others.
In the following, we will present a case of how to apply Orlando's theory in clinic setting. Mr. Hu is a 75-year-old male patient admitted into the hepatology department yesterday with the diagnosis of hepatitis C infection, upper right abdominal dull pain, and jaundice. Mr. Hu was an immigrant to Canada. His mother tongue was not English. He can partially understand what the medical staff said and spoke a little bit English. The nurse Tanya is assigned to Mr. Hu and is providing routine morning care. Tanya notices Mr. Hu is frowning and seems upset. Tanya talks to Mr. Hu to see what is wrong, and he explains to Tanya that he misses his daughter. He has not seen her in over a year, and she is unaware of his health challenges. Tanya assures Mr. Hu she will discuss the issue with the hospital's social worker and will try and contact his daughter so she can arrange a visit. Mr. Hu nods his head and thanks Tanya.
Tanya noticed Mr. Hu is still frowning and asks what the concern is. Mr. Hu told Tanya that he had a stage 3 benign prostate hypertrophy. He has run out of medication and is now suffering a urinary blockage. Tanya figured out that this was an acute on chronic situation. Tanya requested hospital urologists to visit Mr. Hu as soon as possible. After knowing the soon urologist visit, Mr. Hu relaxed a little bit and said thank you to Tanya.
Mr. Hu was still visibly upset and frowning. Tanya asked Mr. Hu what she could do to help him further. Mr. Hu told Tanya that he has chronic pancreatitis and has had many occurrences of acute pancreatic attacks recently. Mr. Hu has expressed he is concerned about the hospital food and does not want his pancreatitis to flare up again. Tanya understands the situation and realizes the need to solve the issue for Mr. Hu. Tanya has requested a dietitian come speak to Mr. Hu so an appropriate meal plan may be provided. Mr. Hu wholeheartedly thanked Tanya for her caring attitude and assistance in the situation.
Miss Hu was still upset. Tanya talked with Miss Hu further and he informed her of his history of atrial fibrillation. He was worried that he could not receive his medication and was concerned about his heart. Tanya requested the cardiologist visit Miss Hu as soon as possible. Miss Hu thanks Tanya for her help.
The next time Tanya saw Mr. Hu, he still seemed upset. After further investigation, Mr. Hu told Tanya he has a dull pain in the right upper quadrant of his abdomen. He has a history of gallstones. Tanya performed a quick abdominal assessment and there was no extreme acute pain, so Tanya told Mr. Hu she will request a visit from the hepatologist and surgeon. After hearing the help, Mr. Hu smiled to Tanya and said, "Thank you so much."
A few days later, Tanya checked in with Mr. Hu and he thanked her for getting all the members of the interdisciplinary team involved to help with his various issues. Tanya noticed Mr. Hu still seems to be in quite a bit of pain, and Mr. Hu told Tanya that his upper right abdominal pain was not totally going away. He didn't know if he can have more painkiller now to reduce his pain. After a quick abdominal examination, everything appears normal. Mr. Hu rates his pain a 7 out of 10. The pain is intolerable for Mr. Hu. Tanya tells Mr. Hu she will inform the physician right away, and Mr. Hu thanks her.
After the physician visit within 24 hours, Mr. Hu received emergency surgery to remove the gallstone and gallbladder. Mr. Hu was on narcotics now. When Tanya entered Mr. Hu's ward, she saw Mr. Hu was in semi-sleep. There was no frowning on Mr. Hu's face anymore. Mr. Hu noticed Tanya visit. Mr. Hu said hello to Tanya. Mr. Hu thanked Tanya for all help and attention that Tanya gave to him. Mr. Hu had a relaxed expression on his face now. The nurse Tanya has applied either Jean or Orlando nursing theory by actively listening to the patient and developing care plans to appropriately care for Mr. Hu. Tanya easily adapts to the situation as complications arise.
Mr. Hu was admitted into the hospital due to upper abdominal pain, exacerbation of hepatitis C infection, and jaundice. After further questioning and assessment, Tanya has discovered that Mr. Hu is also dealing with 1, loneliness related to missing his daughter, 2, stage 3 benign prostate hypertrophy with urinary blockage, 3, atrial fibrillation, 4, chronic pancreatitis with a history of acute pancreatitis, 5, gallstones, and 6, constant dull abdominal pain that has become intolerable. Mr. Hu's abdominal physical examination has shown nothing remarkable at this time.
Bedside nurse Tanya used Orlando's nursing process theory to build a close patient-nurse relationship with Mr. Hu. Tanya attended Ms. Hu's frowning all the time. Tanya tried to provide Ms. Hu with help and care as much as possible in order to solve Ms. Hu's most concerns, such as 1, request a social worker to contact Ms. Hu's daughter to visit him in the ward. 2nd, request the urologist visit to deal with Ms. Hu's stage 3 benign prostate hypertrophy and urinary blockage. 3rd, request the cardiologist visit to deal with Ms. Hu's atrial fibrillation. 4th, request a dietitian visit to deal with Ms. Hu's meal plan in regard to Ms. Hu's chronic pancreatitis, acute pancreatitis history. 5th, request a hepatologist visit and abdominal surgeon visit to deal with Ms. Hu's gallstone and abdominal pain. 6th, request attending physician's immediate attention to deal with Ms. Hu's intolerable abdominal pain at a level 7. Due to bedside nurse Tanya's attentiveness and help, Ms. Hu's issues and concerns were almost all solved. In regard to Orlando's nursing process theory, Tanya successfully built a therapeutic relationship with Ms. Hu and used her clinical knowledge and skill to provide Ms. Hu with help as much as possible, which results in the significant improvement of Ms. Hu's overall health and well-being.
Now we will be discussing an important aspect of patient care, the client goals. With Orlando's model, the patient will rely on the help of the nurse substantially to communicate and interpret his needs. The nurse understands that the goals for Mr. Who may change and expand in a nonlinear manner based on the current needs of the patient. Through conversations with Mr. Who, the nurse has identified and validated the need for the following goals for Mr. Who. First is prevention of complications. Mr. Who has a considerable amount of health issues which affect multiple body systems. Preventing any major complications related to any of his health problems will ensure that maintaining wellness and promoting recovery are possible for Mr. Who. Second is participate in health promotion activities. Mr. Who's reluctance to notify his healthcare team of his medical history will be an important aspect to discuss during health teaching for Mr. Who. Mr. Who will benefit from health teaching and healthy eating, such as many small meals a day, frequency of low impact exercising, frequent checkups with a family doctor, narcotics use and side effects, and hepatitis C complications and treatment options.
Involve daughter in care plan. A major component of Orlando's theory is the involvement of the nurse in problem solving and recovery of the patient. The nurse recognizes the patient's needs for his daughter to be consistently involved in his health care and will continue to foster the relationship to include Mr. Who's daughter. Pain reduction. Reducing the amount of pain Mr. Who has will improve his quality of life and reduce the negative effects pain has on the body. The nurse recognizes pain is an unpleasant experience and concludes the reduction in pain will determine the efficacy of pain relief based on the improvement of Mr. Who's behavior. Promote rest. Hepatitis C and Mr. Who's other chronic health conditions will cause fatigue and tiredness. Mr. Who is also taking narcotic medication, thus resting will be important to facilitate healing and promote safety.
Maintain healthy blood pressure and pulse. Due to Mr. Who diagnosis of arterial fibrillation, it will be important to monitor his blood pressure and pulse and ensure they are within acceptable limits. It may be beneficial of Mr. Who to begin doing this at home after discharge as well. Maintain fluid and electrolyte balance. Due to recent surgery, Mr. Who's heart condition and his prostatic hypertrophy, it will be important to ensure Mr. Who is receiving adequate fluids and avoiding appropriately. Next, we will be evaluating whether the client has met these goals or whether the nurse and client must work together to develop a new set of goals relevant to Mr. Who's current health status.
Client evaluation. Since the nurse has adequately determined and met all of the current needs of Mr. Who, the nurse was able to work effectively with Mr. Who in meeting his goals. Mr. Who's pain has been managed and he is resting well in hospital. The nurse continues to monitor Mr. Who's in and outs and takes vital signs twice a day to ensure he is not experiencing any complications related to his illnesses. Mr. Who has been following a heart-healthy diet that will help prevent pancreatic flare-ups and has shown interest in walking the halls of the hospital for exercise once he is able. Mr. Who understands how hepatitis C is transmitted and is familiar with all the complications that may arise. By maintaining an appropriate therapeutic relationship with Mr. Who and his daughter, the nurse has fostered a relationship where Mr. Who has a diminished sense of helplessness and his needs are being met. With the involvement of specialized professionals, all of Mr. Who's health concerns have been addressed to allow for optimal health in his situation.
Orlando's nursing theory can be applied in the 21st century because it focuses on the patient and the nurse relationship and how the nurse can provide optimal care for their patient through the nursing process, which include assessment, diagnosis, planning, implementation, and evaluation. The reliability of this theory helps other professional staff members to make decisions based upon assessment to move ahead with diagnosis and management steps. It is indeed an easy and fast way to access the information about the client's condition using technology in the 21st century. Moreover, this theory acts as a basis for nursing at all levels, including patient care, management, and nursing divisions.
Orlando's organizing principle can aid in functions of professional nursing. This approach is focused on patients who are in urgent need of assistance. It allows nurses to provide direct assistance to patients in any situation. Orlando also introduced the concept of how to deal with a problematic situation. She states that in addition to giving urgent assistance or identifying a call for assistance, one must first acknowledge a situation as problematic, which is a standard procedure in today's healthcare system.
Orlando also introduced us to the concept that nurses need to show responsiveness to the individuals who suffer from a sense of helplessness. Her theory has interrelated concepts, as mentioned earlier, has a logical nature, is simple to follow, and can be applied today both clinically and theoretically. For example, in the 21st century, patients are treated as individuals who have input into their own care. She has also asserted nursing independence as a profession and her belief that this independence must be based on a sound theoretical framework. Her theory also allows nurses to evaluate patient care outcomes as objectively as possible. Orlando's theory is indeed a highly successful practice theory that is incredibly useful to novice nurses as they begin their career in nursing, current nursing.
Thank you for listening to our presentation today, and we hope you have a wonderful day.